Hello, everyone. This is Nick Despotidis, and I'm here with Academy Co-President Paul Levine. We solicited your most difficult or challenging practice management questions. Paul, thanks so much for joining me today.
Yeah, thank you for having me, Nick. This is a great opportunity to help out our fellow compatriots and answer some questions, so I appreciate the opportunity.
Well, thank you for your help. This question comes from John Keriotis. I also know John very briefly. This guy has good spirit. He keeps asking me questions, and this question I thought was very helpful to all the members. Let me just play it.
Hi, Nick. 2 questions. How do you handle patients of yours who haven't returned in, say, 2 or more years and haven't been getting their Ortho-K annual visits? And the second question, as far as fees go, how do you handle patients who you inherit from other doctors or patients who move to your area and want you to assume their care? Thank you.
I think this is a great question. I really do. Years ago, people would always ask me, how much do you charge? How much do you charge? Now these questions, Paul, are much more sophisticated. They're saying, hey, long term, John's asking, what do you do year 2 and beyond? Would you mind taking a stab at this first?
Yeah, this is definitely a great question. So we're talking about patients that basically have been fit and disappeared from your office, and they're not coming back. Now, of course, I mean, one of the ways that I think you stem that is initially by laying out exactly what's expected, and in our office we have an informed consent document where they specifically initial each section, and one of the sections says that they will come back for all prescribed visits. So they're, contractually, if you will, obligated to come in for those visits. If they decide not to come in for those visits, then, let's say they miss their 6 months, we'll call and just say, hey, we really need you to come in. This is an important appointment that you missed. Please reschedule and come in. If for whatever reason we can't get them to come back, then my assumption there is that they have decided to discontinue Ortho-K. What I do is I actually send a certified letter that states such a thing, which basically, and I won't read the whole thing, but briefly it says that I've learned that they've decided to discontinue their Ortho-K program, and because it is so important for the success of treatment and the health of their eyes to come in for their prescribed visits, that I can't support the use of those lenses without proper supervision. I request that they stop using the lenses immediately, as it's potentially dangerous to do so without proper supervision, and I say I'll make myself available to them, if they have any problems, and I'm happy to take them back as a patient. We send that certified, and once we get back the the little signed card, we put it in their record, and that's all that's all we can do at that point.
Paul, if I said, oh shoot, my son is way overdue, this is what I get, and I say, oh, Dr. Levine, I'm so sorry, it's been 4 years, I can't believe it. What do you do? Do you have a separate fee for that? Do you examine my son?
We have a refitting fee. It's pretty much what I would use if somebody were transferred to my office from another practitioner already wearing Ortho-K lenses. Interesting.
Okay. So you'll take my son back, you'll evaluate him, and then you'll speak to me and say, listen, we need to refit your son, and this is the fee right now to refit him.
Yes. Yeah, and that fee is going to be, that's less than an initial fitting fee.
Right. Right. Is it half a fee just to give the members a third?
Yeah, it's typically about a third.
Okay. All right. And one last question. When does that get triggered? In other words, 2 years, do you refit me? 4 years, do you refit me? Or does it depend on what fit I walk in with?
Well, again, we're talking about a fit that I did originally that now has decided to not come back. It might sound kind of silly, but I haven't really had too many of these happen.
Okay.
To be very honest with you, so I have trouble answering that question.
Well, I can take a stab at it because this was a problem I was unaware of. I mean, I've been busy for at least 10 years where I just assumed incorrectly my patients were coming back to me. And I remember after my workshop, a really nice attendee says, Nick, do you have this problem? And I said, no, not really. And when we went back to look at our records, I had a huge problem. It's very interesting. This demographic, all of us know who fit Ortho-K lenses, is very nervous. And in the beginning years, they're so nervous. They're emailing us questions. That every little kind of like pain or redness, we get a call, email, etc. Right in the college time, they just disappeared on me. That's really what would happen. So we realized this is a huge problem, and we started sending a certified letter. It's very interesting. You and I have never talked about this, and that in my office, that stirred a lot of unrest because patients would call angrily. Again, I sent out a lot. I kind of was really concerned about the gross negligence on my part and maybe the patient's part in not keeping in touch with them. And people would call angrily. There still wore them. They had to go to the post office. So my staff came to me and said, Dr. D, let's do this. Let's send them a letter, not certified. Let's email them. Let's call them. And in the last resort, let's do certified. And I agreed. And I think this is something that really, I think, changed things around. When, like you, the informed consent includes a statement from the CDC, the Center for Disease Control. And it states sleeping with your contact lenses possibly makes you at greater risk for infection or vision loss than when you don't sleep with them. And I thought this was a revelation because now all my patients sign that. And then when they're 2 years or beyond, I send this CDC summary to them, reminding them, listen, this is the CDC says, if your child or you are sleeping with your lenses, you're at a high risk for infection. At this point, my letter probably says what you are, and I'll share my CDC form with the members. And basically, at that point, if it's 3 years or beyond that they're negligent, that sparks a refit fee just like yours. And ours is about a third of what our fee would be, and it's a refit. And that has worked, but it really goes down to the basics of good recall and not letting people go 3, 4, 5 years without it. So we've gotten a lot better at catching people at year 2+. We're not perfect, but I think we both have come to the same conclusion of a certified letter at last resort and trying to be very diligent in recalling them. And the letter has to have a consequence. And in our letter, the consequence is if you don't respond, we're going to start the program from scratch. So between a penalty, the CDC, and us being persistent, we've gotten these college students back into our office. As far as refit, do you take on patients from other doctors, Paul?
Oh, yeah. Mm-hmm.
Okay. And do you charge them your full fee? I think you said about a third to accept them?
I mean, it's always tough because, you know, there's two different scenarios here. You know, there's the Dr. D scenario, which is I'm sending you everything I have. I'm going to make this as easy a transition for you, the doctor, as it will be for the patient. And then I have other cases where a patient walks in and says, I got fit somewhere, I don't have any records, I don't know what I'm wearing, I have one lens that's broken, you know. So you're sort of starting from different points.
Right.
But it's so hard to manage, you know, 20 different fees in your practice.
Right.
So, you know, we basically do a refitting fee. You know, I have two fees basically, which is a refit without need for a new set of molds. They might have just gotten them a month before they moved to my area. Who knows?
Right.
And then I have a fee which is, you know, with new. So, yeah, I would say when they need new lenses and I'm refitting them, that's typically somewhere between a third and a half of what I charge for a new fit.
Yeah, I have some strong feelings on this. You know, Paul was alluding, Paul and I know each other on a very casual basis, very respectful of one another. But amazingly, even though he practices in Massachusetts and I practice in New Jersey, we've had a handful of patients where we've had to email or correspond with one another. My rule is I start from scratch. Unless I know the fitter, and unless Paul said, unless I have exceptional records and a good fit, I don't accept patients from other offices, because we have found corneas which are already molded, to remold them is more difficult than a new patient. So you would think it was easier because they have the INR down pat, they have the system and things like that. We have found, Ivan and I, that these are harder cases. So unless I know someone like Paul or someone who I've known through the academy where I really feel that I have good records, good basis, we start from scratch. We don't charge a refit unless it's coming from someone like Paul, or Julio in Texas sent me some of his patients. So and they send me the data and good records. Then I'll take them on just like you as a refit and maintain their care. So that's how we do that, John. So thank you so much for your question. I think this helped, especially the one about delinquent patients. And if you have any more questions, I look forward to chatting with you at the meeting. Thank you, Paul, too.